Antimicrobial drugs, including antibiotics, can be life-saving when they're needed, but increasingly, bacteria are becoming able to resist antimicrobials. This is called antimicrobial resistance, or AMR, and it's a global threat to human and animal health. Reducing the use of antimicrobials is advocated as an important part of stopping AMR, but this can be difficult in parts of the world where the burden of infectious diseases that require antibiotic treatment is high. In low and middle-income countries like Tanzania, the AMR problem can be made worse by the fact that in rural areas, people and livestock often live close together, raising concerns as to the possible transmission of antimicrobial-resistant bacteria between them. These are also areas where access to healthcare, including high-quality antibiotics and professional advice, is limited. Tanzania has created an ambitious national action plan to combat AMR. However, as a One Health problem, it can be difficult to understand the complex system of drivers behind AMR transmission. Successful implementation of the National Action Plan is challenged by a lack of human and financial resources, making prioritization of activities and interventions essential. This Medical Research Council-funded project brings together a consortium of scientists, social scientists, and government stakeholders. The team includes members from the University of Glasgow, the Tanzanian Ministry of Health, the Kilimanjaro Clinical Research Institute, the Catholic University of Health and Allied Sciences, and the Nelson Mandela African Institution of Science and Technology, as well as other institutions. Its aim is to provide insights into biological, social, and cultural drivers of AMR in health systems and communities in Tanzania at individual, community, institutional, and policy levels to support this prioritization of activities and interventions. Taking a One Health approach, this interdisciplinary study is being carried out within several regions of Tanzania, representative of the three predominant livestock production systems: agropastoral, pastoral, and rural smallholder. Socioanthropological methods will be used to elicit information on knowledges, attitudes, practices, and access to antimicrobials across tiers of the hospital system and the distinct livestock keeping communities. These will include focus group discussions, surveys, questionnaires, in-depth interviews, and observations. In addition, we will use economic approaches such as choice experiments and microcostings to generate evidence on pecuniary and non-pecuniary incentives that could be used to optimize use of antimicrobials, both in terms of individual patients and farmers, as well as their health providers. We will examine genomic data from clinically important bacteria across the hospital system and livestock keeping communities. We will use a range of bioinformatic and epidemiological modeling methods to explore the contribution of transmission within and between hospitals and the community to the clinical and economic burden of AMR in the health system. This will allow us to prioritize levers of change in health facilities and livestock keeping communities based on predicted feasibility and impact. Finally, using a bespoke and theoretically informed approach, we will co-construct, design, deliver, and evaluate AMR awareness campaigns at hospital and community levels to learn how best to communicate information on this topic in a culturally appropriate context and manner. By involving professionals, the public, and policymakers, these campaigns will also contribute to capacity strengthening across all layers of society in Tanzania.